Welcome back to Insight. We're at Goshen Center for Cancer Care, and we want to talk about some more of the advanced techniques and treatment options, especially when you come for a second opinion to Goshen Center for Cancer Care. And we have Dr. Wheeler here, and I know there's 4 magic letters that I need to ask you about. IORT.
Yeah, those stand for intraoperative radiation therapy. Traditionally, when we give radiation therapy for breast cancer, the surgeon takes the tumor out. There's several days that the pathologist looks under it under the microscope, and then based upon what they find, we then give several weeks of radiation. Can be as many as 6.5 weeks, could be as short as 3.5 weeks. With intraoperative radiation, once the surgeon takes the tumor out of the breast, we immediately put the radiation device into that cavity and give the radiation at that time. Takes about 20 minutes or so, depending upon a number of different factors. And for many women, that's the only radiation that they'll need. So they don't have to come back for 3, 4, 5, 6 weeks of radiation treatments once a day, Monday through Friday. So it's much more convenient for them. And
it seems like that is a technique that has to improve, well, quality of life, certainly just my day-to-day routine, a number of things. Is it medically advantageous as well?
It's a technique that's only appropriate for women with early stage breast cancer. If people have more advanced breast cancer, the radiation doesn't go out far enough to get rid of all of the cancer cells. So it's only for people with very early stage cancers. And for them, it's an excellent treatment because not only does it get the treatment performed quickly while they're there in the operating room anyway, but it also has such a short range of radiation that it doesn't damage the heart or the lungs or those other things that we worry about so much.
And so it is literally all one thing, one trip, I guess, to the hospital.
Correct.
More or less.
The woman would come into the hospital. The surgeon would check the sentinel lymph nodes to see if there's any cancer in the lymph nodes. The surgeon takes the tumor out of the breast. The radiation is given in the operating room while the patient's under the same anesthesia. So when she wakes up and is ready to go home from her surgery, she's finished with her radiation too.
Wow. Is this perhaps going to be used in other treatments of other cancers other places, or is this specifically advantageous for breast cancer?
This particular application is for breast cancer, but the same device is used to treat skin cancers. Mm-hmm. And so, for instance, we have a patient now who's getting 6 treatments of radiation using this device, and that replaces 25 of the other treatments.
Wow.
And so instead of coming every day for 5 weeks, he comes twice a week for 3 weeks. It wasn't difficult to convince him that he should try that. Mm-hmm. With fewer side effects.
Well, right, and so it seems like that is another reason that it would be better. Again, just fewer side effects, more convenient. The other thing I think that people need to remember is that when you come to Goshen, no matter what stage you're personally in, you're going to treat the patient, not the cancer.
Correct. And every patient gets evaluated by a whole team. So they'll be seen by evaluated with surgeons and pathologists and radiologists and radiation oncologists, dietitians, counselors. They may not see all of those people, but there are discussions and conferences that are going on in the background.
Yeah, and which is, again, the way that you want to be treated. And so, so that you've got all these brilliant minds working together in harmony. That's got to be a much more interesting way for you to work, wouldn't you say?
Oh, it's very rewarding. No one person has all of the ideas, and it's great to put the best people together and get the different competing views and differences, and that's so you can get the best possible care for patients.
When the word cancer enters your vocabulary, you want to make sure that you go to the right place for a second opinion, Goshen Center for Cancer Care. You can find out more on their webpage, which is livestouched.com. We will be right back on Insight.